Welcome to Science Force, where science comes alive. Hello everyone and a very warm welcome to all of you. Today we are bringing you a really vibrant explainer that bridges the gap between your everyday posture and some seriously intricate clinical science. Whether you're a professional just trying to sit up straight at your desk or a dedicated life science or medical student, we are going to make this complex spinal condition incredibly clear. So I want you to ask yourself right now, is your modern technique just a bad, pesky behavioral habit, or could it actually be the beginning of something much deeper? Is that slouch becoming structural? Today we are completely unraveling the curve of the spine to understand exactly what happens when our back loses its natural, healthy balance. Okay, let's dive right into our agenda for today. We'll start with the anatomy of a curved spine, look at the 5 specific types of kyphosis, break down the causes and clinical symptoms, figure out how doctors diagnose the Cobb angle, and finally wrap up with some solid treatment and prevention strategies. 1. The anatomy of a curved spine. Kicking things off with Section 1, the anatomy of a curved spine. We are looking at the journey from natural shock absorption to excessive rounding. You know, it's actually fascinating. This very modern problem of us slouching over our keyboards gets its name from ancient antiquity. The word kyphosis comes directly from the Greek word kyphos, which literally means hump. In a clinical setting, it simply refers to an excessive forward curve of the thoracic spine, which is your upper back. Now, a normal spine is absolutely a marvel of engineering. It naturally has a slight inward curve in the neck and lower back, called lordosis, and a slight outward curve in the upper back, which is a natural kyphosis. You see, this is what gives us our built-in shock absorption. But in a kyphotic spine, that thoracic curve becomes exaggerated. The shoulders roll forward, the head protrudes entirely out of alignment, and the muscles, well, they are placed under tremendous constant strain. 2. Types of kyphosis. Let us move on to Section 2, the 5 types of kyphosis. Here we are distinguishing harmless postural habits from actual structural deformity. Now, what's really interesting here is the stark contrast between the 2 most common forms we see in adolescents. Postural kyphosis. This is flexible, it's usually completely painless, and it is entirely behavioral. It's just your classic teenagers slouching. The vertebrae themselves remain perfectly normal. Schauman's kyphosis is a rigid structural deformity. During growth spurts, the vertebrae actually grow unevenly, becoming wedge-shaped instead of rectangular. Simple posture correction won't fix this because it is anatomically locked in. But the list doesn't stop there. We have 3 more critical types to cover. Congenital kyphosis, present right at birth, usually caused by incomplete vertebral formation in the womb. Age-related kyphosis, primarily driven by osteoporosis in older adults. Weak bones lead to compression fractures, creating what we commonly call a dowager's hump. Secondary kyphosis. This is a consequence of other events like spinal trauma, a destructive infection, or neuromuscular disorders like cerebral palsy and spina bifida, which impair the body's physical ability to hold the spine upright. This brings us to Section 3. Causes and clinical symptoms. Here's where the stakes escalate rapidly, going from simple muscle fatigue to severe nerve compression. So, what actually triggers this? Well, the causes are incredibly diverse. They range from everyday lifestyle issues like poor posture and technique right through to systemic conditions like osteoporosis. We also have to consider the severe medical triggers: congenital genetics, brutal spinal trauma, infections like tuberculosis, which can literally destroy vertebral tissue, and complex neuromuscular disorders like cerebral palsy and spina bifida, which impair the body's physical ability to hold the spine upright. Because the causes vary so much, the symptoms scale dramatically along with them. Mild symptoms, often mostly cosmetic and a bit discomforting. You might see a visible hump, rounded shoulders, and experience back pain or muscle fatigue. Severe symptoms, when that curvature is extreme, it can actually compress the chest cavity, leading to compromised lung function and severe breathing difficulties. If the spinal cord gets involved, patients face dangerous nerve compression, resulting in numbness, tingling, and very real weakness in the arms or legs. 4. Diagnosing the Cobb angle and the clinical metrics of spinal curvature. Right, let's jump to section 4. How do we actually measure this? Let's talk about diagnosing the Cobb angle and the clinical metrics of spinal curvature. Now, before a doctor ever thinks about putting a patient into heavy medical machinery, they follow a standard, rigorous clinical pathway. Step 1. Simply the medical history, really listening to the patient detail their pain and posture changes. Step 2. A thorough physical examination where the physician actively evaluates the spine's shape, checks the patient's flexibility, balance, and even tests their reflexes to spot any neurological issues. Only after all that do they proceed to imaging studies. When they do move to imaging, the choice of the machine is highly specific. An X-ray is your fundamental tool. It clearly shows the degree of the curve and the actual shape of the vertebrae. But if a patient presents with those severe neurological symptoms we just discussed, like numbness, the doctor is definitely going to order an MRI scan, which provides incredible detail of the soft tissues, the spinal cord, and the nerves. Alternatively, a CT scan might be chosen to map out highly complex structural bone abnormalities. And here's the absolutely crucial point, especially for the medical and life science students tuning in. The Cobb angle. This is the gold standard clinical measurement. It's the precise mathematical angle used by orthopedic doctors on an X-ray to determine exactly how severe that spinal curvature is. Let's break down this scale because this is where it gets interesting. You see, a spine is actually not supposed to be perfectly straight. A normal thoracic curve actually has a Cobb angle of 20 to 45 degrees. That is perfectly healthy for shock absorption. Mild kyphosis is diagnosed when the angle is just slightly above that 45-degree mark. Moderate becomes much more visible to the eye, and severe kyphosis, that is a markedly increased angle that brings with it a very high risk of organ compression and serious neurological complications. 5. Treatment and prevention. Moving to our final section, Section 5, let's look at treatment and prevention strategies, the interventions used to correct alignment and relieve pain. Treatment is like a ladder. It builds up systematically. Step 1, we usually begin quite conservatively with observation and targeted physical therapy, using back extensions and core strengthening to naturally pull the spine back into alignment. Step 2, particularly for growing adolescents, is bracing, to physically support proper alignment before their growth is complete. Step 3 involves medications to manage pain or bone strengtheners for osteoporosis patients. Step 4, surgical intervention. For those truly severe cases where the curvature is literally limiting someone's breathing or seriously compressing nerves, we have to look at spinal fusion surgery. This is the ultimate surgical intervention. The orthopedic surgeon permanently joins the affected vertebrae together. The goal here is to correct the alignment, permanently stabilize the spine, and relieve that severe nerve compression. But for the vast majority of us who are just dealing with everyday postural strain, the power of prevention is entirely in our hands. Maintain good posture. Seriously, elevate your screens to eye level. Exercise regularly, specifically targeting your core and back strength to build a natural muscular corset for your spine. Maintain your bone health by making sure you get enough calcium and vitamin D. Make time for regular health checkups. Which brings us to a final, somewhat provocative thought. In our modern world, where bright and vibrant screens are constantly, relentlessly pulling our heads forward every single day, what is your Cobb angle telling you right now? Are you giving your back the support it actually needs to stand tall? I urge you right now to sit up straight, take a deep breath, and carry this knowledge with you. Thank you so much for joining me on this explainer. Keep learning, take care, and stay healthy.
Thank you for watching Science Force.